Dear friends, I've written an article in my Times of India blog today. It talks about public health not being a science. Now, I think this is a fairly important article, uh, particularly since you've been told for the last 3 years that you've got to follow the science. But I argue and I demonstrate conclusively that public health is not a science. So, what have you been doing? You've been following nonsense, and I'll show what kind of nonsense you've been following. So I won't go into the details of this article. There's a lot of it that I've discussed. I'll just take one example, the case of masks. So I'll show you with the example of masks why public health is not a science. So what do we need to know if masks have to be imposed on the entire society? So let's say, public health says they are very wonderful things. So what do we need to impose them on society? Well, we need to know that actually they do work, and that's the first thing we need to know. At least they do some reduction in infection and so on. But even assuming that they were doing a lot of this kind of reduction in infections, by the way, which is not true, and I'll come to that separately. Let's leave it for now. Let's assume that they were actually working. You need to then work out how many lives they would save. Okay. And each of the lives has a measure called quality adjusted life year. And so you need to convert that into QALYs. And that's your benefit. And then you need to look at the costs. Now, let me just go back to this fact that masks actually do nothing. So that's the recent study on 30th of January 2023 by the Cochrane, the institute, considered the highest standard of quality in terms of measurements of scientific studies. It has looked at all these studies and says there's no clear reduction of any of these virus things because of the masks, and it makes no difference whether you wear a surgical or N95 masks. So basically, masks don't work. But let's assume that they work. Okay, so I'm just assuming that they work. But then we look at the fact that they don't do science, because if you were to look at the impact of masks for the entire public, which is what so-called public health does, you would definitely want to see what are the costs of masks. But guess what? The only analysis of the costs of masks that I've seen in public health is in the pandemic guidelines of the WHO. And what do these guys say? They say, here it is, there are no major effects of face mask use. Okay? They may be uncomfortable and so on, but there's no effect. So what I've called this is not just bad science, this is nothing short of nonsense. Why so? Well, the first thing is, you look at the data, you can check from the internet. There's about $5 billion being spent per year on masks. All right? That's not free. That's not a minor effect. That's a huge amount of money being spent. And particularly for the poor, let's say a person who earns $2 a day, that person has got children to look after. He's got to buy masks for 20 cents, and that is the displaced food and medicines for the children. And that's a reality, okay? So you need to look at that particular effect. That's a cost of the masks. And then there is the time cost of all these things. We have to count the time cost and opportunity cost. The time to buy the mask, the time to carry it around, store it around carefully, and where do the poor people store it in the first place? Okay, and then they have to use the mask. Then there's the environmental waste generated, assuming that they don't reuse the same mask, so people are then need to throw somewhere. And in India, for example, there's no place to throw anything. The poor have no place, so they throw it on the roadside, and that adds to the environmental waste. Then you consider the fact that people are producing masks instead of producing something more useful. Okay, and that particular thing means the resources are being wasted. Of the society's resources are being wasted in mask production. And that's only one part of the story. What about the effect of the masks on children? Children who are being spoken to with people in masks, they can't understand what they've been told. They've never learned to, their speech development is delayed. And the deaf cannot hear in any case with the masks. And the elderly are tripping all over the place and falling down because the masks reduce peripheral vision. And what about the germs on the masks that collect particularly in humid climate, and when the poor are reusing the masks? So when you're reusing the mask, you get more of the disease. And so I know about the case of dentists who have been saying that masks use had dramatically increased cavities because germs have just stayed inside the mouth and they've just accumulated. And there's so many other harms. I won't even go to the details. There's lots and lots of other harms from masks. So now you need to add these costs, and you need to count them, and you need to convert them into QALYs. There are methods to do that in economics. But guess what? Public health never does any of this. Public health does nothing in terms of analyzing the effect of any of its policies on the entire public. So based on some random study which says masks work, which actually they don't, as we've seen clearly they don't, but let's assume that they work. Based on a single study that say there's some benefits, they just impose it on everybody. All right, so what I'm saying is, this is just one example. Lockdowns is another example. You've seen the cost-benefit analysis that I've done with Gigi Foster. There's vast numbers of harms from lockdowns. Vast. It's absolutely unbelievable. But these guys have never counted even one of these costs, ever. There's no study from the public health community, World Health Organization, saying that these are the costs of lockdowns. So they never do science, okay? So let me be very, very clear. These guys are doing nonsense. They're not doing anything to do with science. So when they say that we follow the science, well, we're following nonsense. And anyone who's been believing this stuff of public health has been following nonsense. Now, I've also shown in my Twitter account today that if they were to do science, then the four things would immediately disappear. Border closures would go completely. They're complete nonsense. Lockdowns are, of course, extraordinarily harmful. The harms are in the range of hundreds of times compared to any benefits. Masks would go 100%. There would be no possibility of any masks in public health. Completely, untenable. And vaccine mandates would, of course, go. Now, I've also mentioned that none of this will happen. None of this, because public health has got the incentive problem. They've been minting money. Millions and millions, and I would say billions of dollars have been minted by public health practitioners because it's a completely captured community. They've been making vast amounts of money, and they are very good at propaganda. They can create terror and fear at any moment they want. And so then people clamor for these kind of things like lockdowns and masks and all these vaccines and so on. So now the net result is, unless you wake up, you the person listening, unless you wake up, public health is going to cheat you till the end of your life and the end of the lives of your children and grandchildren and so on. Public health is a criminal organization. It's a gang of thugs. They are not doing any science. They are doing nonsense. And they're cheating you black and blue. I don't know what it's called, black and blue or whatever. They're just cheating everybody, all right? So keep this in mind when you are told that you got to follow the science. All right, then, that's all for today. Thank you.